students, welcome to this first lecture on refraction. Now, refraction traditionally has been a chapter where most students have a lot of problems. So that is why this chapter on refraction, I have broken it up into many small lectures in which I will try to cover the core concepts of refraction so that you will be able to answer the conceptual questions that come from here. And also I will try to tell you small tips and tricks to answer the slightly tricky and difficult questions which are asked from here. So this is the first lecture on refraction, and in this lecture I will be covering the basics of refraction, which is optics. So what are the things we will learn here? So in this, we will learn about the eye as an optical system. We will learn about the eye as an optical system, and we will learn about the optics of the refractive errors. Okay, so what do I mean when I say that we will be talking about the eye as an optical system? See, if we have to study refraction, for some time we have to kind of forget that the eye is actually a biological structure, and we will try to look at it in terms of an optical system, meaning we have to imagine that the eye is like a convex or a converging lens. Now, what is exactly a converging lens or a convex lens? Now, if we put it very simply, so see, this is a converging lens or a convex lens, which means that the parallel rays of light, which means the rays of light which are coming from a distant object, that is the distant rays or the parallel rays of light, when they pass through a converging or a convex lens, then they are bent and they are made to meet at a point. Now, what is this point called? This point is called as the focus. It is called as what? It is called as the focus of that particular converging lens or convex lens. Now see, because this convex lens is actually bending the light rays, making them meet at a point, so it's also called as a converging lens. And when you pass a screen through this focus, then what happens? Then you can get an image of that distant object. Right? Now, as I told you, when we look at the eye as an optical system, it is also very similar to a convex or a converging lens. Now, what do I mean when I say that? See, I will now in the next picture just replace this converging lens with a diagram of the eye. So now look at this. See, these are the parallel rays of light. That is, what do I mean by parallel rays? Again, the rays of light which are coming from a distant object. Now, when these light pass through this eyeball, then they are bent and they ultimately meet at this point, which is F, and this is located on a curved screen. Now, what is this curved screen with respect to the structures of the eye? I think common sense tells us that this is nothing but a retina where the image of the distant object is going to be formed. Right? So this is how the eye behaves as a converging or a convex lens. Now see, if it is a converging or a convex lens, obviously it's going to have some power. So what is the refractive power of the eye? The refractive power of the eye is around 58 to 60 diopters. So this is the power of the eye. Now see, once again, when I say that the eye is a converging lens or a convex lens, you all understand that it is kind of an oversimplification. So it is actually a system of structures which together function as a converging lens. So this brings us to the next concept or the next question as to which are the refractive media of the eye, or which are the structures which are participating in this process of refraction. So see, the refractive power of the eye is around 60 diopters, as I told you, around 58 to 60 diopters. And the refractive media are the cornea, the aqueous humor, the lens, and the vitreous humor. So see, in the first chapter, that is the codes and contents of the eyeball, we learned that these are the structures through which the light is passing, and ultimately it is meeting on the retina. So see, these refractive media are not just meant to allow the light to pass through. They of course have to allow the light to pass through, but at the same time they also have to bend the rays, otherwise how will these parallel rays meet? So this ability to bend the light rays is actually the refractive power. So the power of the cornea is 44 diopters on an average. Now 44 diopters is the average. The range you can say is something between say 40 to 46 diopters. Right? So the maximum bending is happening at the anterior surface of the cornea. So the cornea has the maximum refractive power and the maximum refraction or the maximum bending of the light rays. This is important for MCQ, that the maximum bending of the light rays happens at the anterior surface of the cornea. Okay, so like around 2/3 of the power is coming from the cornea. Now the lens contributes about 16 diopters of power. Once again, the range you can say is around 12 to 18 diopters. Okay, so the remaining power essentially is contributed by your lens. So 44 diopters by the cornea and around 16 diopters by the lens. Now just add these two, it will come to 60. So what does this mean? It means that the aqueous and the vitreous humor are not contributing much to the power. The other way of saying this is that there is not much bending of the light rays in the aqueous and the vitreous humor. The light rays are obviously passing through it, but the bending is happening at the cornea and the lens. Okay, so 2/3 of the power roughly is contributed by the cornea, maximum bending or maximum refraction happening at the anterior surface. Okay, so this is how the distant rays or the parallel rays are brought to focus on the retina. But see, in life, we are always not looking at distant objects. We also have to look at near objects, that is, objects which are close to us. So then, how will those rays be brought to focus on the retina? Now, let me go back to this picture. Now, let us assume that this eye maintains a constant power of 60 diopters, meaning it doesn't change. Then what will happen to rays of light which are coming from a near object here? So suppose there are rays of light which are emanating from a near object here. Now see, these light rays are actually diverging rays. So if you keep a constant power of 60 diopters, now this 60 diopters of power was enough to bring these parallel rays, that is the distant rays, to meet on the retina. But when you have rays of light coming from a near object which are diverging rays, if you keep a constant power of 60 diopters, then these rays will end up meeting somewhere here. That is at the point F dash, which is behind the retina. Okay, so this means that this eyeball cannot maintain a constant power of 60 diopters. It has to change. So, in order to refocus from a distant to a near object, the eyeball has to change its refractive power. And obviously, you understand that these rays, because they are divergent rays, you actually will need more power. You will need to bend the light rays more to bring them to focus on the retina. So, this process where there is an increase in the refractive power of the eyeball, that is called as accommodation. So, what is accommodation? Accommodation essentially is an increase in the refractive power of the eye in order to usually bring a near object to focus on the retina. So, for a person who has no refractive error, that is, who is an emetrope, then the distant rays will normally focus on the retina. To bring the near rays to focus on the retina, an emetropic person will have to use his accommodation. So, what is accommodation? From an optics point of view, accommodation is an increase in the refractive power of the eye, because to bring the near rays to focus on the retina, I need to increase my refractive power. Now, how do you increase this refractive power? The structure which is actually responsible for this is your crystalline lens, but it is aided by the ciliary body. So what actually happens is there is a contraction of the ciliary body. So see, this lens is a biconvex structure. It is suspended by the zonules and attached to the ciliary body. Now, when there is a contraction of the ciliary body, there is an opposite effect on the zonules. The zonules, they relax. So see, these zonules which were tight like this, they kind of become loose or relax like this. So now what will happen, if the zonules, they become loose, then this biconvex structure, above and below, it was tightly pulled by these zonules. When these zonules, they become loose, then this biconvex structure becomes more curved. So there is essentially an increase in the curvature of the crystalline lens. So this increase in the curvature of the crystalline lens is actually responsible for this increase in refractive power. So just to put it together, accommodation is the process of increasing the refractive power of the eye. So in a person who is an emetrope, meaning who doesn't have a refractive error, accommodation is used to bring a near object to focus on the retina. So how is this brought about? This is brought about by the contraction of the ciliary body, which leads to a relaxation of the zonules and an increase in the curvature of the crystalline lens. Okay, so this is the eye as an optical system, meaning the optics of the emetropic or the normal eye. Right? So the distant rays, the parallel rays, see, they are being brought to focus on the retina, and the near rays are being brought to focus on the retina by the process of accommodation. Now, as a person ages, then physiologically this amplitude or this power of accommodation starts decreasing. So see, I am an emetrope. Now, as the power of accommodation becomes weaker and weaker, what will happen? I will not be able to focus at near objects. So then my near vision will start becoming difficult. And what is this called? This is called as presbyopia. So see, presbyopia is not an error of refraction. It is a physiological decrease in the amplitude of accommodation which happens with age. So a physiological decrease in the amplitude of accommodation which is happening with age, that is presbyopia, and it happens to everyone around the age of 40 years, and the patient will develop, and the person will start developing difficulty in near work because he is not able to accommodate sufficiently. So then how do we help this person? Obviously, to help this person, we have to give him glasses for near work. But then what kind of glasses should we give? Should we give plus lenses or minus lenses? Obviously, we have to increase the power. If he's not able to accommodate himself, we have to give that plus or that increase in his glasses. So we have to give convex lenses or plus lenses. So convex lenses or plus lenses for near work, that is the treatment for presbyopia. So presbyopia, this is a physiological decrease in the amplitude of accommodation that happens with age, and the treatment for this is convex lenses or plus lenses for near work. Okay, now this presbyopic correction, what does it depend on? Now, presbyopic correction depends on two things. One, the age of the patient, and also the distance at which he does the near work. So the older the patient, the more correction he will need. And also the standard working distance that we have is around 33 to 40 centimeters. So the standard reading distance is around 33 to 40 centimeters. But if a person reads at a closer distance, or the person is, for example, a diamond cutter, a jeweler, or a tailor whose working distance is less, that person will require more correction. So presbyopic correction depends on two things. The older the patient, the more will be the correction needed. And secondly, the closer the distance, the more will be the correction. So increased age will have more correction, will need more correction, and also a closer distance of working will need more correction. Okay, so this is about presbyopia, right? So all this that we have discussed till now, this is physiological. This is physiological. Now I am coming to the optics of the refractive errors. So what are our refractive errors? What are the refractive errors? I think this all of you know. The major refractive errors are these. They are myopia, hypermetropia, and astigmatism. So myopia, hypermetropia, and astigmatism. So in this particular lecture, I will just be concentrating on the optics of these refractive errors. Right? The clinical features, the treatment, all that we will be discussing in subsequent lectures. So in this, we will be talking about the optics of these refractive errors. So let me start with the first one, that is myopia. So see, this is our eye as an optical system. These parallel rays are supposed to meet here at the point F, which is on the retina. So this point F, this has to be on the retina. Right? If these parallel rays or distant rays are not meeting on the retina, that is when we say that the patient is having a refractive error. Okay, so look at this. Myopia. So what is the problem in myopia? So all these that we are going to discuss here, they can come as image-based questions. So have a look at this myopia. So in myopia, what is the problem? The problem is that these parallel rays or distant rays, after refraction through the eyeball, are meeting at this point F. Now, where is this point F? See, this point F is in front of the retina. So instead of meeting on the retina, the parallel rays or the distant rays, they are meeting at a point F which is in front of the retina. That is the optics of myopia. So see, in an emetropic eye, that is an eye which does not have a refractive error. This we call as an emetropic eye. The parallel rays or the distant rays are meeting on the retina. In a myopic eye, they are meeting in front of the retina. Now how about hypermetropia? Exactly the opposite. See here, the parallel rays of light or the distant rays. See, the parallel rays of light or distant rays, they are meeting at this point F which is behind the retina. They are meeting at this point F which is behind the retina. So exactly the opposite of each other. Myopia, the light rays, the parallel light rays meet in front of the retina after refraction through the eyeball. In hypermetropia, they meet behind the retina. Now this part is actually simple. The difficult part comes when we discuss the optics of the third type of refractive error, which is astigmatism. Now what is astigmatism? Now see, when we talk about the eye, we assume that this eye is actually a perfect sphere like this. Now when you have a perfect sphere, then the vertical and the horizontal axis, vertical and the horizontal curvatures, they are equal. So the V is equal to the H. But actually the shape of the eyeball is not a perfect sphere. In most cases, you will find that this eyeball is not a perfect sphere. The V and the H are not equal. In most cases, the V will not be equal to the H. So either you will have, the eyeball will be like this or it will be like this. So see, this is more of an elliptical shape, which means that either the V will be greater than the H or the H will be greater than the V, which means that either the one of the curvatures is more than the other. So either the vertical curvature will be more than the horizontal or the horizontal curvature will be more than the vertical. So in most of the cases, this is how it is, right? So if you assume the eyeball to a perfect sphere, the vertical and horizontal curvatures are equal. But in most cases, the eyeball is not a perfect sphere, so the vertical and horizontal curvatures are not equal. So what happens is that when we all know that the curvature is actually determines the refractive power. The curvature determines the refractive power. So if the vertical and horizontal curvatures are not equal, the refractive powers in these two meridians will also not be equal, right? So when a bundle of light rays is striking the eyeball, what will happen is the refraction in the vertical and the horizontal meridians will not be equal. So the rays which are undergoing refraction on the vertical meridian will meet at one point, and the rays undergoing refraction in the horizontal meridian will meet at another point. So this means that instead of one focal point, you will end up with two focal points, that is F1 and F2. So this is the problem in astigmatism. So see, till now when we were talking about myopia or hypermetropia, here there was no difference between V and H. These eyeballs are perfectly spherical. So that's why myopia and hypermetropia, they are also called as spherical errors. Why we are calling them as spherical errors? Because here the eyeball is actually a perfect sphere. There is no difference between V and H. All the light rays are meeting at a single point only. But in myopia, they are meeting at a single point in front of the retina. And in hypermetropia, they are meeting at a single point behind the retina. However, in astigmatism, the problem is that the eyeball is not a perfect sphere. The V and the H are not equal. So I don't have a single focal point. I end up with two focal points, F1 and F2. Right? So this is the core concept of astigmatism. Now we will come to the most difficult part here, that is the different types of astigmatism. So let's look at this image. The first one, this is called as simple myopic astigmatism. Now what is simple myopic astigmatism? Here see, the set of rays which strikes the eyeball, these parallel set of rays, these are the distant rays, they come as a single bundle. But after undergoing refraction, see, they are meeting at two focal points. The points are F1 and F2. Now, I think I'll just explain one to you. After this, the others you will be able to do it yourself. So see, what can we say about the status of the rays which are meeting at F1 and what can we say about the status of the rays which are meeting at F2? Now the rays which are meeting at F1, that particular meridian is actually normal or emetropic. So see, F1, this is emetropic. This particular meridian is emetropic because the rays are meeting on the retina. How about F2? F2, see, the rays are meeting in front of the retina. So this is myopic. So what is an SMA? SMA means that out of the two principal axes, one axis is emetropic. So see here, F1, one of the two axes is emetropic and the other axis is myopic. So this is called as simple myopic astigmatism, SMA. Okay, now what is the counterpart of this? The counterpart of this is this, that is SHA, simple hypermetropic astigmatism. Now here, the parallel rays, when they come in as a single bundle after refraction. See, they are meeting at 2 points, F1 and F2. Now, what is the status of F1? Once again, see, the meridian which is meeting at F1 is emetropic because the light rays are meeting on the retina. Now, what do I say about F2? Yes, in F2, see, they are meeting behind the retina. So I will say that F2 is hypermetropic. So how am I going to define SHA or simple hypermetropic astigmatism? That out of the two axes, one axis is emetropic. So see here, F1, it is emetropic and the other axis is hypermetropic. So one axis is emetropic and the other axis is hypermetropic. So this is SHA. So see, what is the concept of simple astigmatism then? The basic concept of simple astigmatism is that out of the two axes, one has to be normal or emetropic and the other one will be defective. Now if the defective one is myopic, we will call it SMA, and if the defective one is hypermetropic, then we are going to call it as SHA. So this is simple astigmatism. Right? Now I'll take it a step forward. Now if something is simple, that obviously tells us that there is something which is compound. So the next one is this, that is compound myopic astigmatism. So what do we mean by compound myopic astigmatism? Now you follow the light rays here. I think you will be able to solve it yourself. So see, these parallel rays, they are meeting at 2 points. Again, let me name them as F1 and F2. Now tell me, think, what is the status of F1 and F2? So see here, both F1 and F2, both of them are myopic. Right? Both are meeting in front of the retina, but they are not equally myopic. See, F1 is actually more myopic than F2 because it is meeting further away from the retina. So the two axes are myopic, but they are not equally myopic. One of the axes is more myopic. So F1 here is more myopic than F2. So how am I going to define this CMA? So I will write that here both the axes are myopic. So both the axes are defective and both are myopic, but one axis is more myopic than the other. So both axes are myopic, but one axis is more myopic than the other. So this is called as CMA or compound myopic astigmatism. Now you can understand from common sense what will be CHA. So what is CHA? Compound hypermetropic astigmatism. That is this. So here see, the parallel set of rays, they have come in as a single bundle and they are meeting at 2 points, F1 and F2. Now what can we see about the status of F1 and F2 here? Just like the previous diagram. See, there I said both are myopic. Here see, both are hypermetropic. So both F1 and F2, both of them are hypermetropic. But which is more hypermetropic? They are not equally hypermetropic. F1 is more hypermetropic than F2. So what should I write about CHA? I will write that both axes are hypermetropic. So both the axes are hypermetropic, but one axis is more hypermetropic than the other. Both axes are hypermetropic, but one axis is more hypermetropic than the other. That is CHA. So here, let me just quickly revise as to what is the difference between simple and compound astigmatism. So see, in simple astigmatism, the concept was that out of the two axes, one has to be normal or emmetropic and only the other one will be defective. So if the defective axis is myopic, we call it SMA, and if the defective axis is hypermetropic, we call it SHA. But how about compound astigmatism? In compound astigmatism, both the axes are defective. So either both will be myopic or both will be hypermetropic, but not equally. One of the axes will be more defective. So see, if both are myopic and one is more myopic, I will call it as CMA. And if both are hypermetropic and one is more hypermetropic, I will call it as CHA. Okay. And the last one is this. This is called as mixed astigmatism. Now what is this? So here see the parallel set of rays which have come in, and one meridian has met as F1 and the other has met at F2. So what is the status of F1 and what is the status of F2? See, F1 is myopic. It is meeting in front of the retina. And what about F2? F2 is hypermetropic. So F1 is myopic and F2 is hypermetropic. So how do we define this? This means that out of the two axes, one axis is myopic and the other axis is hypermetropic. So here also both the axes are defective. It is not like only one is defective, but they are defective in a unique way in the sense that one of the two axes is myopic and the other is hypermetropic. Okay, so all this that we have discussed, that is the spherical errors, the optics of myopia, hypermetropia, and the 5 different types of astigmatism: SMA, SHA, CMA, CHA, and MA. All these can come as image-based questions. So you can get any of these images, and we have learned how we have to decipher these images. All of them can come as image-based questions. Okay, now let us see how much all of you have understood. Now these 5 types of astigmatism that we have just talked about, they are called as regular astigmatism. Now, when you represent these 5 types of regular astigmatism in a single picture, this is called as your Sturm sphenoid. Now, Sturm sphenoid has also been recently asked in one of the exams. Now, how the question is asked, let me explain this picture to you. You will be able to solve the questions by yourself after that. Now, in this Sturm sphenoid, see, they have represented, these are the rays undergoing refraction in the vertical meridian, and this is where they are meeting. I will name this point as FV. And see, these are the rays, I just show them in another color. These are the rays which are undergoing refraction in the horizontal meridian. See, these are the rays undergoing refraction in the horizontal meridian, and I will name this point as FH. So see, now you have these positions A, B, C, D, E, F, G. Now each of these positions represents a type of astigmatism. So you can be given this picture and it can be asked that suppose the retina is at the point A. What is the expected refractive error? So I will just solve this first one for you. The others you will be able to solve by yourself. So see, if the retina is at the point A, see both FV and FH are behind. So both the axes are hypermetropic. But mind you, they are not equally hypermetropic. This FH is far more hypermetropic than FV. Correct? So if I have the retina at the point A, both FV and FH are hypermetropic. But FH is more hypermetropic than FV. So what is this point A? This point A obviously is CHA, that is compound hypermetropic astigmatism. Okay, now let us take the concept to the next position. Suppose we have the retina at the point B. If the retina is at the point B, then what is the refractive error? What is the refractive error that the point B represents? See, when the retina is at the point B, FV is on the retina, so FV is emmetropic, and FH is behind the retina, so FH is hypermetropic. So FV is emmetropic, FH is hypermetropic. So what is this point B? This point B represents SHA, that is simple hypermetropic astigmatism. That is, FV is emmetropic, FH is hypermetropic. Right? Now let us take this point F. If you take the point F, then see, if I take the point F, then FH is emmetropic, FV is myopic. So FH is emmetropic, one axis is emmetropic, other is myopic. So point F represents SMA, that is simple myopic astigmatism. Now how about the point G? If I take the point G, then see both FV and FH are myopic. FV is more myopic than FH. FV and FH are myopic, FV more than FH. So this point G represents compound myopic astigmatism. Right? Now the points C, D and E, they are the same actually. Let's take the middle point. Suppose the retina is passing through the point D. If the retina is passing through the point D, then see FV is myopic, FH is hypermetropic. So this point D represents mixed astigmatism. So this is how in the Sturm sphenoid different positions tell us about the different positions represent the different types of regular astigmatism. So these 5 types of astigmatism, they are all represented together in this picture, in this diagram, which is your Sturm sphenoid. Now this can come as an image based question. We can get this and you can be given any of these points like A, B, C, D, E, F, G, and we may be asked what is the refractive error if the retina passes through this point. So this is actually easy. If you know all these images, then we just have to apply these previous images to this term sphenoid and we will be able to answer. So this is the optics of the different types of refractive errors. So now we have talked about regular astigmatism. There is one last concept that is there. That is the concept of what we call as irregular astigmatism. So what do we mean by irregular astigmatism? What do we mean by irregular astigmatism? Now, astigmatism which does not follow this pattern, this particular pattern that is there of where the two principal axes are perpendicular to each other, if that pattern is not followed, then that is called as irregular astigmatism. So irregular astigmatism means that the two axes, that is the two principal meridians, are not perpendicular to each other. So here see, in all these forms of regular astigmatism, the two axes, that is the V and the H, they are perpendicular to each other. Here the two principal meridians, if they are not perpendicular to each other, then that is called as irregular astigmatism. Now, where exactly do we get this irregular astigmatism? We get irregular astigmatism in conditions like, for example, if there is a corneal scar, if there is a keratoconus, some kind of corneal pathologies where the surface of the cornea is very, very uneven or irregular. That is where we have these types of astigmatism which do not fall under this category, all these categories that we have described, where the two axes are not perpendicular to each other, where they cannot be classified into these subtypes like CMA, CHA, SMA, SHA, etc. So when that kind of astigmatism is there associated with corneal pathology, like as I said, corneal scars and keratoconus, that is called as irregular astigmatism. So please remember this, that in irregular astigmatism, the two principal meridians are not perpendicular to each other. Okay, so this is the basic optics of refractive errors. So just to go over what we have learned in this session and what you need to know for your exam. You need to know the optics of the normal eye. That is, you need to know what are the refractive media, what is the refractive power, which structure contributes maximum refractive power. You need to know what are the steps of accommodation, and you need to know the images of all the refractive errors, that is myopia, hypermetropia, SMA, SHA, CMA, CNS. We will be discussing how that optics actually translates into glass prescriptions. Okay, so what are the topics that I will be covering here? I will obviously first be looking at the types of lenses. Then we will learn, as I told you, how the optics of the different refractive errors translates into the glass prescriptions, and then we will learn how to solve the questions on glass prescriptions, which traditionally all students find difficult. So we will look at small tips and tricks to do that. First, we will go through the simple ones and then the difficult ones. And then I will also discuss WTR and ATR astigmatism, that is with the rule and against the rule astigmatism. And these are like questions which are being commonly asked because they are conceptual, and most students have difficulty in these questions. So we will try to make it as easy as possible so that at the end of this session, you will be confident that all questions on astigmatism, optics and glass prescriptions, you will be able to answer effortlessly in the exam. Right? So now when we talk about lenses, that is what are the lenses in our glasses, see, you all know that there are two basic types of lenses, right? So obviously you will have either a minus lens or a plus lens, correct? So what is a minus lens? A minus lens is called as a concave lens, and a plus lens is called as a convex lens. A minus lens is a concave lens and a plus lens is a convex lens, right? Now, if you have seen the lenses in the trial frame with which we do our refraction, you will see that some of the lenses are red in color usually and the others are black in color. So conventionally, the red lenses are the minus ones, they are the concave lenses, and the black ones are actually the plus lenses, that is the convex lenses. Okay, so now see, apart from this, there is another way of classifying lenses, that is whether they are spherical lens or whether they are cylindrical lens. That is another way of classifying lenses. So now have a look at this. See, look at this image. See, they are in black, so we understand it is a plus lens. Now, the first one that you see, look at this lens here. We have in this lens, this one, we have say +4 written here, and we have +4 written here also. Right? So this is actually a spherical lens. Now let me explain what I mean by a spherical lens. Now a spherical lens means that this lens, it has the same power in both the axes. So if this is a +4 diopter spherical lens, so how do we represent a spherical lens? We will write S. S means spherical. So see, this is a +4 diopter sphere or a +4 diopter spherical lens means that this lens gives +4 power in the vertical axis and it gives the same +4 power in the horizontal axis also. Or I should say that in both the principal meridians, this lens will give the same power. So it gives equal power in both axes. It gives equal power in both the axes. That is a spherical lens. Okay, now look at the second picture. This is a cylindrical lens. Now what do I mean when I say cylindrical lens? Now look here. Here we have +2 written in this axis, but in the other axis nothing is written, only a line is there. So basically these lenses look something like this. So there is a +2 or some number written here, and here there is just a line. So what does this mean? It means that the cylindrical lens will have power only in one axis and the other axis will not have any power. So depending on how you place this lens. So suppose I place this lens like this, I can have +2 written here, or I can have +2 written here with the line here. Whatever be the case, I will either have +2 in the vertical axis or I will have +2 in the horizontal axis. I am not going to have it in both axes. So a cylindrical lens, essentially, this is a cylindrical lens. Now what do I mean by cylindrical lens then? It means that it has power only in one axis. It has power only in one axis and there is no power in the other axis. That is a cylindrical lens. Okay, so you can have plus cylindrical lenses and spherical lenses. Similarly, we will have minus cylindrical and spherical lenses also. So the basic classification of lenses into plus and minus, that is convex and concave, and further they are divided into spherical or cylindrical depending on whether they have power in both the axes or they have power only in one axis. So in a spherical lens, the same power will be there in both the axes, whereas in a cylindrical lens, there will be power only in one axis. So one axis will have power and the other axis will have zero power or it will have no power. So this means that depending on how the cylindrical lens is placed, that is, I can place the cylindrical lens like this or I can place it like this. So in one case I will have power in the horizontal axis and the vertical will have no power. In another case I will have power in the vertical axis and the horizontal will have no power. So therefore, whenever we have a cylindrical lens, we will never write just +2 diopter C. We have to write some axis in front of it. We have to write, say, +2 cylinder cross 90, or you have to write +2 cylinder cross 180. So that axis tells us how the cylindrical lens has to be placed. Okay, so with a spherical lens, you will not find any axis written in front of it, but whenever the prescription has a cylindrical lens, there will always be an axis written in front of it because that number tells us how the cylindrical lens has been placed, because see, there will be power only in one axis. Correct? How to determine this axis, I will tell you in another session, that is in retinoscopy. In this session, we will just concentrate on understanding how the optics of the refractive errors is actually translating into the class prescription, and that will be enough for you to solve questions on class prescriptions. Okay, so let's take this forward. So quick recap of what is of the images that we did in our previous session. All of you understand this is myopia. Why? Because as I have told you, the distant rays, which are the parallel rays, are meeting at this point F, which is in front of the retina, right? So this much we have learned in our previous session. Now I want you to think, what is the power of this eyeball? Yesterday, in the previous session, I told you that the power of an emmetropic eye is around 60 diopters, right? In our previous session, we have learned this. Now, if you look at the myopic eye, what do you think is the power of the myopic eye? Does the myopic eye have more power than it needs, or does it have less power than it needs? So now, if you think about it, you will realize that these rays should have actually met here on the retina, correct? They should have met here. This should have been your point F. But why are they meeting in front of the retina? Because the light rays are being bent more than necessary. So this eyeball is bending the light rays more than necessary, right? So this means that it has more power than it needs. The light rays are being bent more than necessary, which means that this eyeball has more power than it needs. So then, what is the lens that you will use for the treatment of myopia? Will you use a plus lens or will you use a minus lens? Obviously, see, if it has more power, I am going to use a minus lens. So the treatment of myopia is minus, that is concave lens. Now, what kind of concave lens? Will it be concave sphere or concave cylindrical? If you remember in the previous session, I told you in myopia and hypermetropia, there is no difference between the two principal axes, and that is why they are called as spherical errors also. So this means whatever power I give or whatever correction I give, I have to give equally in both the axes. So therefore, the treatment of myopia is minus or concave spherical lens. Minus or concave spherical lens. This is the class prescription for myopia, right? I will show you an example after we have done the next one, that is hypermetropia. So let us look at hypermetropia once again. See, the parallel rays of light are meeting at this point F, which is behind the retina. Now see, essentially hypermetropia is the opposite of myopia. So here the light rays, these light rays should have actually met here on the retina. They should have met here. But why are they meeting behind? They are meeting behind because the light rays have not been bent enough. So if the light rays had been bent adequately, they would have actually met on the retina. But because the bending is not enough, that's why they are meeting behind the retina, which means this eyeball has less power than it needs. So a myopic eyeball has actually more power than it needs. That's why we are treating it with a minus or a concave lens. Now hypermetropia, see, it has less power than it needs. So common sense says that I have to treat it with a plus lens, that is a convex lens. Once again, see, there is no difference here between the two principal axes. So just like myopia, hypermetropia will also be treated with a spherical lens. So what is the treatment of myopia? That is a concave or a minus spherical lens. And what is the treatment for hypermetropia? It is a plus or a convex spherical lens. Right? So let me show you an example, and that is going to make things a little easy for you. So let us look at this example. So see, suppose we get this class prescription. -3 diopter sphere, -3 diopter sphere. So what is this? This is a concave sphere or a concave spherical lens. Right? So what is this refractive error? If we are given this class prescription, what is the refractive error? It is obviously a simple myopia. So it's a simple myopia. Correct? Now the same thing, look at this, this is a +3 diopter sphere. So what is this? This is a convex spherical lens, that is a plus sphere or a plus spherical lens. So a plus or a convex spherical lens. So if we get this prescription in the exam and we are asked, what is this refractive error? What is this? This is a simple hypermetropia. This is a simple hypermetropia. So if we have a minus sphere, it's a simple myopia. If it is a plus sphere, it is a simple hypermetropia. right? So up to here, I think it was simple. There is really nothing to confuse. The confusion actually starts happening when we start discussing astigmatism. So let's go back to the pictures of astigmatism first. So if you remember in the previous session, we had learned about SMA and SHA. So what is SMA? Simple myopic astigmatism. See, the parallel set of rays came in as a single bundle, but then they meet at 2 points, F1 and F2. F1 is emetropic and F2 is myopic. So F1 is emetropic and F2 is myopic. I hope you can recall this from our discussion in the previous session. So now see, if we have to give a glass prescription for this, now see here, I need to correct only the axis F2 because the rays which are getting refracted on the axis F1 are actually meeting on the retina. So I don't need to correct the axis F1, I only need to correct the axis F2. So therefore, I need to give a lens which will correct only the axis F2, only the defective axis it will correct without disturbing the other axis. So then what is this lens which gives power only in one axis? Obviously it is a cylindrical lens. Now what cylinder, plus or minus? Obviously this is myopic, so it will be a minus cylinder. So here the prescription for SMA is a minus or a concave cylindrical lens. Minus or a concave cylindrical lens. Minus or a concave cylindrical lens. Okay, I'll just explain this once more. See, the axis which is meeting at F1 is already emetropic. That axis does not need any correction. So the correction is to be given only on the defective axis. So I need a lens which is going to correct only the defective axis. So I will use a cylindrical lens. What kind of cylinder? Because the defective axis is myopic, I will use a minus cylinder or a concave cylinder. So the prescription for SMA is a concave cylindrical lens. Now what is the counterpart of SMA? The counterpart of SMA is obviously SHA, simple hypermetropic astigmatism. Right? Now SHA, we discussed this in our previous session. So see, look at this. This is F1, this is F2. Once again, see, F1 is emetropic because the rays are meeting on the retina. And what can we see about F2? F2 is obviously hypermetropic. So F1 is emetropic and F2 is hypermetropic. So here also the same concept holds true. Here also I do not need to correct the axis F1. I need to correct the axis F2 only. So once again, if I need to correct only one axis, I will use a cylindrical lens. Now because this defective axis is hypermetropic, I will use a plus cylinder. So see, the treatment of SHA is a convex, that is a plus cylindrical lens. So a plus cylindrical lens, this is used for the treatment of SHA, that is simple hypermetropic astigmatism. Okay, now let me show you the examples which will make it a little easy for you to understand. So look at this prescription. What is this? Minus 3 diopter cylinder cross 180 or minus 3 diopter cylinder cross 90. I told you we cannot just write a cylindrical prescription. Always we will need to write the axis because that decides how we are going to place the cylinder. So both these are, what are they? They are concave, that is minus cylindrical lenses. So concave or minus cylindrical lens. So if we get this in the exam, then what is the refractive error we will write? So for a concave or minus cylindrical lens, the refractive error is SMA, simple myopic astigmatism. Okay, now the counterpart of this is this. So see, plus 3 diopter cylinder cross 180 or plus 3 diopter cylinder cross 90. So what are these? These are convex or plus cylindrical lenses. So if we have this prescription in the exam where we have a convex or a plus cylindrical lens, then this denotes SHA, simple hypermetropic astigmatism. Right? So I'll just quickly go over what we have done so far. So see, what did we learn? If you have a minus sphere or a concave sphere, it is simple myopia. If you have a plus sphere or a convex sphere, it is simple hypermetropia. If you have a minus or a concave cylinder, it is SMA. And if you have a plus, that is a convex cylinder, then it is SHA. Right? So I hope up to here is clear to everybody. Now I'm going to take this a step forward. It will become a little difficult as we move forward from here. So let's go back to the remaining refractive errors, the images. So have a look at this. So we finished with SMA and SHA. What is left? We are left with CMA and CHA. So what is CMA? If you remember this diagram from our previous session, see, these are the parallel rays of light and they are meeting at 2 points, F1 and F2. But both the axes here are defective, unlike simple astigmatism where only one axis is defective. Here both axes are defective. So see, we had learned that F1 and F2, these are both myopic. Both F1 and F2 are myopic, but F1 is more myopic than F2. Correct? Remember, so both F1 and F2 are myopic, but F1 is more myopic than F2. This is one way of looking at it. Now I'll just try to tell you another way of looking at the same image. Now when you look at this image, what is the other way of saying it? The other way of saying it is that there is an overall myopia and there is an extra myopia only on the axis F1. So overall the globe is myopic and there is an extra myopia on F1. Right? Now if you look at it with this concept, what can you say? For the overall myopia, what will I give? What do I give for a myopia? I am going to give, for the overall myopia, I am going to give a concave sphere. I am going to give a concave spherical lens for the overall myopia. But see, there is an extra myopia on F1. So how will I correct that extra myopia which is only on F1? Obviously, if I have to correct only on one axis, what will I do? I will use a cylinder. So apart from this concave spherical lens, which is for the overall myopia, I have to add an extra cylinder only to the axis F1. So this prescription will have both a concave spherical lens and it will have a concave cylindrical lens also. So in this prescription, there will be a concave sphere which is for the overall myopia, and for the extra myopia on F1, there will be a concave cylinder. Okay, it will become clear when we look at the examples. Let me finish with the counterpart of this, that is CHA or compound hypermetropic astigmatism. Now what is this? Here also the concept is the same fairly, that the parallel set of rays come in as a single bundle, but after refraction they meet at 2 points, F1 and F2. And what will we say about F1 and F2? We will say that both F1 and F2 are hypermetropic. But which is more hypermetropic? Again, F1 here is more hypermetropic than F2. Okay, so the same way we looked at CMA, we can look at CHA also. That is, the overall the globe is hypermetropic, and there is an extra hypermetropia which is only on F1, right? So overall there is a hypermetropia and there is an extra hypermetropia only on F1. So for the overall hypermetropia, what will I give? For the overall hypermetropia, I will give a convex spherical lens. But then I also have to correct this extra hypermetropia on F1. So for that, I am going to use a convex cylindrical lens. So a convex spherical lens and an extra convex cylindrical lens only for that axis, that is F1. Right? So for a compound astigmatism, whether it is CMA or CHA, you will have both a sphere and a cylinder. So if it is CMA, you will have a minus sphere and minus cylinder. If it is CHA, you will have both plus sphere and plus cylinder. Once again, let me show you the example that will make it a little easier. Look at this. See, minus 2 diopter sphere and minus 3 diopter cylinder cross 180, or minus 2 diopter sphere, minus 3 diopter cylinder cross 90. So both of them, see, what do they have? See, the first part, this is the concave sphere. The minus 2 diopter sphere, this is the concave sphere. And what is the rest of it? The rest of it is a concave cylinder. So this prescription has both a minus sphere, that is a concave sphere, and a concave cylinder. So if it has both, then what is it? It is CMA, compound myopic astigmatism. Right? Now let's look at this. Suppose we have something like this, plus 2 diopter sphere, plus 3 diopter cylinder cross 180, or plus 2 diopter sphere, plus 3 diopter cylinder cross 90. So here also, see, both these prescriptions, what do they have? They have a convex sphere. The first part is a convex sphere, and what is the second part? It is a convex cylinder. So there is a plus sphere and there is a plus cylinder. Both are there in the prescription. So if you have both a plus sphere and a plus cylinder, what is this? This is CHA, compound hypermetropic astigmatism. Okay, so I'll just go over this once more to make it clear for all of us. So see, I'll just write a few examples here for you. Suppose I write something like this, say minus, if we have just a minus sphere, like for example, say minus 4 diopter sphere. What is this? There is only a concave sphere here, right? So there is only a concave sphere, a minus sphere. So what is this? This is a simple myopia, right? Now suppose I write, say minus 2 diopter cylinder at any axis, say 90 or 180. So there is only a minus cylinder here. So this is SMA, simple myopic astigmatism. Now, if I have a prescription like this, where I am writing minus 4 diopter sphere and say minus 2 diopter cylinder cross 180, if both are there, that's a minus sphere and a minus cylinder, both are there in the prescription, then that is CMA, compound myopic astigmatism. So only minus sphere, simple myopia, only minus cylinder, SMA, both minus sphere, minus cylinder, CMA. The same can be extrapolated to plus also. So suppose I write something like this. Suppose I write, say, plus 2 diopter sphere. What is this? This is a simple hypermetropia. This is a simple hypermetropia. Now if I write something like, say, plus 2 diopter cylinder at any axis, that is say 90 or 180, what is this? This is a plus cylinder only, so this is SHA. Now if we combine, if we have a prescription where there is both, say plus 2 diopter sphere and say plus 3 diopter cylinder at any axis, 90 or 180. So this prescription has both a plus sphere and a plus cylinder, so this is CHA, compound hypermetropic astigmatism. Okay, so I hope up to here is clear to everybody. You will be able to solve prescriptions from here. So the only one that remains is this one, the last one, that is mixed astigmatism. So just to recall the image of mixed astigmatism, it looks something like this. If you remember from our previous session, that in mixed astigmatism, the parallel bundle of rays, they end up meeting at 2 points, F1 and F2. But here our F1 is myopic and our F2 is hypermetropic. F1 is myopic and F2 is hypermetropic. Okay, now I will not really go into the details of how this translates into a class prescription because it is a little complicated and it's not actually necessary. I'll tell you how to identify this prescription. So have a look at this. This is what a prescription of mixed astigmatism looks like. So look at the first one, plus 2 diopter sphere, minus 3 diopter cylinder cross 180. And look at the second one, minus 2 diopter sphere, plus 3 diopter cylinder cross 180. So what do you see in both these prescriptions? You see that the sphere and cylinder are of opposite signs. The sphere and cylinder are of opposite signs. So see, either we will have a minus sphere with a plus cylinder or we will have a plus sphere with a minus cylinder. So minus sphere with plus cylinder or plus sphere with minus cylinder we will have. And the second point is that the absolute value of the cylinder will be always greater than the sphere. So here see this 3, cylinder absolute value is 3 and sphere absolute value is 2. So the absolute value of the cylinder will always be greater than the sphere. This is what the prescription of mixed astigmatism looks like. So, how do you identify a prescription of mixed astigmatism in the exam? In a prescription of mixed astigmatism, you will have the sphere and a cylinder will be of opposite signs. So either you will have a minus sphere with a plus cylinder or a plus sphere with a minus cylinder. And very, very important is this, that the cylinder, the absolute value or the numerical value of the cylinder will be greater than the sphere. So this is what a prescription of mixed astigmatism looks like, right? Now let's do a quick recap to see how much every one of you has retained. We have learned all the types of simple prescriptions possible. Before I go on to tell you the difficult prescriptions, I want to quickly revise the simple prescriptions. So let us look at the simple prescriptions. So look at this. What is this? Minus 3 diopter sphere. This is a minus sphere, correct? So minus sphere means this is a simple myopia. This is a simple myopia. Now if I say plus 2 diopter sphere, what is this? This is a plus sphere. So this is a simple hypermetropia. I hope you people are being able to understand and recall what we just learned. So minus sphere, simple myopia, minus cylinder, simple hypermetropia. Suppose we have a minus cylinder. A minus cylinder means SMA. What does a plus cylinder mean? Plus cylinder means SHA. Minus cylinder SMA, plus cylinder SHA. Now if we have both minus sphere and minus cylinder, so both sphere and cylinder are minus, this is CMA. Now if both sphere and cylinder are plus, that is, if both sphere and cylinder are there and both of them are in plus, then this is CHA. Right? Now if we have a prescription like this, that is minus 4 diopter sphere and say plus 5 diopter cylinder at any axis. So see, there is a minus plus combination, a minus sphere with a plus cylinder, and very, very important to note that the numerical value of the cylinder is greater than the sphere. So this is a prescription of mixed astigmatism. So when you have a minus plus combination, that is a minus sphere with a plus cylinder or a plus sphere with a minus cylinder, and the numerical value of the cylinder is greater than the sphere, then that is a prescription of mixed astigmatism. So these are your simple prescriptions. I hope you will be able to solve them now. Now, there are a couple of difficult prescriptions which can come, which I want you to know. Now, these difficult glass prescriptions are solved by a process, by a method which is called as transposition. Now, why do I say they are difficult glass prescription? They are difficult glass prescription because they are written in a way that is not common to what, that is not similar to what we have read now. That is a different way of representing the same glass prescriptions. So sometimes they can also be given to you. They may be given to you because they are used by opticians when they write glass prescriptions. So even in your practical life, you can get or encounter these prescriptions because in optical centers, prescriptions are written in another notation or another form also. Now, if you tend to get a glass prescription in that way, then how do you solve it? We solve it by transposition. Now see, suppose we have a prescription which looks like this. That is, say minus 2 diopter sphere and say plus 1 diopter cylinder cross 90. Right? Now see, this is not a prescription of mixed astigmatism. Now till now, the only place where we have encountered a plus minus combination is mixed astigmatism. Otherwise, we have in CMA and CHAC, it is either both minus or both plus. The only place where we have encountered a plus minus combination is MA, that is mixed astigmatism. But I repeated it again and again that in mixed astigmatism, the numerical value of the cylinder will always be greater than the sphere. Only then it is mixed astigmatism. Now look at this prescription. See? This is not mixed astigmatism. Why? Why this is not mixed astigmatism, though it is a plus-minus combination? Because see, the numerical value of this cylinder is less than this sphere. The numerical value of this cylinder is less than this sphere. So therefore, this is not mixed astigmatism. This is one of those prescriptions which is written differently. It is not mixed astigmatism. So if you get this in the exam, how are you going to solve this? We solve it by a method which is called as transposition. So what do I mean when I say transpose? When you transpose, the first step is you algebraically add up the sphere and the cylinder. So see, minus 2 is my sphere and plus 1 is my cylinder. So I will algebraically add these two. So minus 2 plus 1 will give me minus 1. So that will be my sphere. So I will first algebraically add up the sphere and the cylinder. So minus 2 plus 1 will become my sphere. So that's minus 1 sphere. Now for the cylindrical part of the prescription, what I have to do is, I have to change the sign and the axis of the cylinder to exact opposite. So plus 1 diopter cylinder cross 90 will become minus 1 diopter cylinder cross 180. So I have changed the axis and the sign of the cylinder to exact opposite. Now look at this. This is a prescription that you understand. So what is this? This is a minus sphere and a minus cylinder. So what is this? This is something we understand. This is a concave sphere and this is a concave cylinder, correct? So when you have both concave sphere and concave cylinder, then what is this? This is CMA, compound myopic astigmatism. So see, this is nothing but another way of representing the CMA. So I'll just go over this once more. So if you get this kind of a plus minus prescription, be very, very careful with plus minus prescriptions because they may be either mixed astigmatism where there is a plus minus combination and the numerical value of the cylinder is always greater than the sphere. If that is the case, it is simple. You mark it as MA. But when you have this kind of a plus minus prescription where the numerical value of the cylinder is less than the sphere, then please remember that when the cylinder is less than the sphere, that is not a mixed astigmatism. That is actually a prescription written in a different way. So this prescription we will transpose. What is the step? What are the steps of transposing? First, you algebraically add up the sphere and the cylinder. So -2 plus 1 becomes -1. So -1 diopter sphere. And for the cylindrical part, you change the sign and the axis of the cylinder. So -1 diopter plus 1 diopter cylinder cross 90 becomes -1 cylinder cross 190. So now see, this is a prescription in a format we understand. So minus sphere minus cylinder means CMA. Okay, so this is one type of difficult class prescription that can come. I'll show you another one. Suppose you have something like this. Say -2 diopter sphere and say +2 diopter cylinder cross 90. Suppose you have this. Now see, this also is a plus minus combination, but once again, this is not mixed astigmatism. Why we are not saying this is not mixed astigmatism? Because here the numerical value of the sphere is equal to the cylinder. Please remember that for MA, the numerical value of the cylinder has to be greater than the sphere. Now, if it is less than the sphere, you have to transpose. If it is equal also, you transpose. So let us transpose this. The method of transposition remains the same. So you algebraically add up the sphere and the cylinder. So -2 plus 2 becomes 0. So there is no sphere. And for the cylindrical part of the prescription, I will change the sign of the cylinder and the axis to opposite. Okay, so now there is no sphere. The sphere plus minus became 0, and now we are left with only this. So this is our prescription, -2 diopter cylinder cross 180. So what is this? This is a format again which we understand. So this is nothing but a concave cylinder. So what is my refractive error? It is, what is the refractive error? It is SMA, simple myopic astigmatism. So it is simple myopic astigmatism. Okay, so these are the two slightly difficult types of prescriptions that can come. So see here, the first example that we saw was where there is a plus minus combination, but the cylinder is less than the sphere. So when I transposed, I got this. And this format I understand, concave sphere, concave cylinder, that is minus sphere, minus cylinder, that is CMA. Now here in this, the sphere and the cylinder are equal. Once again I transpose, and when I transpose, I get this, where there is a concave cylinder. Now this is also a format I understand, this is SMA. So these are the two difficult prescriptions that can come. They have less likelihood, of course, of coming, but this kind of completes everything that can come from here. Okay, so see here we have discussed how to solve the simple class prescriptions. We have also learned how to tackle the difficult class prescriptions where we have a combination of plus and minus. Okay, now the next thing that we have in this chapter is this, WTR and ATR astigmatism. Now this is another way of classifying astigmatism, with the rule and against the rule. Now WTR, it stands for with the rule, with the rule. And ATR stands for against the rule, against the rule. Now, what do you mean by with the rule and what do you mean by against the rule? Of course, we have to learn the definition. The definition of with the rule is that the vertical meridian is more curved, it is more myopic, or it is less hypermetropic than the horizontal. That is what we mean by with the rule. So remember these three things, that the vertical axis is more curved, the vertical axis is more curved, it is more myopic or less hypermetropic than the horizontal. This is what we mean by WTR. Obviously, ATR is the opposite. So learn up one definition, the other is the opposite. Otherwise, we will get confused in the exam. So what is WTR or with the rule? It means that the vertical axis is more curved, it is more myopic, or it is less hypermetropic than the horizontal. And ATR is the exact opposite of this. Okay. So normally, our vertical axis is a little more myopic than horizontal, and that's why that is called as with the rule. Right? Because normally also, in most people, the vertical will be slightly myopic than horizontal, and that's why this is called as with the rule. So I repeat, the definition is that vertical axis is more myopic, more curved, or less hypermetropic than horizontal. So this, of course, the definition can come in the exam, but what also comes is this. That is, you get a glass prescription, and from that glass prescription, you are expected to say whether it is WTR or ATR. So suppose you get a glass prescription, how will you identify? See, there are different ways of doing it. But I will tell you the simplest way according to me, because in the exam it is not just important to solve the question, it's also important that we do it in a definite amount of time, because our time is also a factor. So I do it this way, that for WTR, just memorize this rule. What is the rule? The rule is that to see whether it is WTR or ATR, you have to look only at the cylindrical part of the prescription. You can forget the spherical part of the prescription. Just look at the cylindrical part of the prescription and see if there is a minus cylinder cross 180, or if there is a plus cylinder cross 90, then that is WTR, with the rule. This is with the rule, and therefore the opposite of it is against the rule. If you apply this, you will be able to solve the questions. So minus cylinder cross 180 or plus cylinder cross 90 is with the rule. Opposite is obviously against the rule. So let me show you an example. Suppose you have a prescription like this. Say -2 diopter sphere and say -2 diopter cylinder cross 180. Suppose you get this prescription. So as I told you, you have to look only at the cylindrical part of the prescription, that is this, -2 diopter cylinder cross 180. So what is this? It is with the rule. Okay, so this is a prescription of with the rule. And what is a refractive error, by the way? See, there is a minus sphere and a minus cylinder. Both of them are there. It's a concave sphere, concave cylinder. So it is CMA, compound myopic astigmatism. And to know whether it is with the rule or against the rule, I have to look at the cylindrical part. And minus cylinder cross 180 means WTR. So this is the answer that you have to mark. It is CMA, compound myopic astigmatism. Why? Because there is a minus sphere and there is a minus cylinder in the prescription. So that is why, see, there is a minus sphere and minus cylinder. So it is CMA. And why it is WTR? Because in the cylindrical part of the prescription, I see minus cylinder cross 180. Okay, now suppose I give you this prescription, say plus 2 diopter sphere and say plus 2 diopter cylinder cross 180. If I give you this prescription, then see what is this? This is CHA, compound hypermetropic astigmatism, and see plus cylinder cross 180 means against the rule. Plus cylinder cross 180 means against the rule. Okay, so this is a prescription of CHA ATR, this is CMA WTR. Okay, now you can get it like this also. Suppose you get this minus 2 diopter cylinder cross 90. What is this? See, first part is what is the refractive error? There's only a minus cylinder, so what is it? It is SMA, simple myopic astigmatism, and minus cylinder cross 90 means against the rule. So this is the option you have to mark. I will explain this once more. See, minus 2 diopter cylinder cross 90. Minus cylinder or concave cylinder means what? It is SMA, simple myopic astigmatism, and minus cylinder cross 90 means ATR, against the rule. Suppose I give you this minus 2 diopter sphere plus 4 diopter cylinder cross 90. Now what is this? See, it's a minus plus combination, minus sphere with plus cylinder, and the cylinder is greater than the sphere. So what is this? If the numerical value of the cylinder is greater than the sphere, we will call it MA, mixed astigmatism. And how do I classify it as WTR, ATR? I look at the cylindrical part of the prescription, and in the cylindrical prescription, there is a plus cylinder cross 90. So plus cylinder cross 90 means WTR. Okay, so to these questions, there are two parts to these questions. First, you have to identify what is the refractive error, which is essentially what we have been discussing in this session. So see, when you get this prescription, minus 2 diopter sphere plus 4 cylinder cross 90, the first step is to identify it is MA. Why I am saying it's mixed astigmatism? Because minus plus combination and the absolute value of the cylinder is greater than the sphere. So I am calling it mixed astigmatism. Next, to classify it as WTR, ATR, I have to look at the cylindrical part of the prescription. So here there is a plus cylinder cross 90, so it is with the rule. Okay, so essentially, if there is a minus cylinder cross 180 or plus cylinder cross 90, it is with the rule. So just look at this. See, in the first one, minus cylinder cross 180, so with the rule. In the second one, plus cylinder cross 180, so against the rule. Third one, minus cylinder cross 90, so again against the rule. Plus cylinder cross 90, so with the rule. Okay, so this is about WTR and ATR astigmatism. Now, WTR and ATR astigmatism, we have to of course know the definition, and we have to know how to solve these class prescriptions. And essentially, WTR astigmatism is easier to correct clinically than ATR. Okay, so this is about our class prescriptions and astigmatism. Now, the last concept that we have is this concept of irregular astigmatism, which I was also talking about in our previous session. Now, we have learned about the optics of the different types of refractive errors, and we have also learned how that optics channelizes into a glass prescription. Now, in all these types of astigmatism, you have seen it is important that the two principal axes are perpendicular to each other. The two principal meridians have to be perpendicular to each other. Now, if that doesn't happen, that is if the two meridians are not perpendicular to each other and they don't have any predictable pattern, then that is called as irregular astigmatism. So, in all the types of astigmatism that we have learned, they are all regular astigmatism. Remember, I told you they are represented on the Stern's conoid. They follow a very predictable pattern. But if that predictability is not there, if the two axes are randomly inclined, they are not perpendicular to each other. They are inclined at an axis which is random, and they are also not following any particular pattern. Then, suppose they are inclined like this. They are not following any particular pattern, then that is called as irregular astigmatism. It is seen in corneal pathologies like scars and keratoconus. And the problem with irregular astigmatism is that it does not improve with glasses, and you have to give contact lenses. RGP, rigid gas permeable contact lenses, are used for the treatment of irregular astigmatism. Okay, we will be learning about the treatment of different types of refractive errors in our subsequent sessions. But just here I want to complete this session with this irregular astigmatism, with the basic concept that irregular astigmatism is seen in corneal pathologies like scar and keratoconus, where the two principal axes or meridians are not perpendicular to each other and there is no predictable pattern, does not improve with glasses, and it is corrected by contact lenses. Okay, so this was our session on glass prescriptions, and I hope that at the end of this session you will feel much more confident about tackling questions on glass prescriptions in your exam. So I will continue in the next session. So as I told you, this refraction I have split into multiple small sessions, and in the next session we will be learning about the clinical features of the different types of refractive errors. So this is our session on glass prescriptions. Thank you.